Hi, I'm Stephanie, and I'm going to be demonstrating the skill of IV insertion. So for starters, we're going to wash our hands. Hand hygiene is the most important to begin any skill. And then we're going to go to the patient and we're going to identify the patient. So this is John Doe. And then you're going to ask the patient for their name and their date of birth and then correlate it to their wristband. John Doe, whatever year. Correlate to the wristband, you got the right patient. All right, and then you're going to start talking to the patient about why you want to be giving them an IV. So we can be doing it for many reasons. You will be doing it maybe because they're NPO and you want to have them still receive their medications and fluids, potentially for faster absorption of medications and fluids, or for emergent medications or fluids. Once you've explained to the patient what you're doing and why you want to be doing it, you need to obtain a verbal consent from the patient. Once the patient says it's good, you're ready to go. Before you start an IV, you're going to want to make sure that you have all the supplies necessary so that everything is prepared and ready for you when you're there. So we're going to have gloves, you're going to have your saline flushes, your tourniquet, gauze to wipe up any excess blood that might spill out of the IV when you insert it. You're going to have your IV, which today we're going to be using a 20 gauge needle IV, and then this is going to be your J-tube extension kit, and then you got your tegaderm and tape and alcohol swabs. Alright, so I've washed my hands again, I've put on my gloves, and now we're going to be applying the tourniquet to the patient who we've already identified. Alright, next we're going to locate a vein that we like. And I'm going to go with this one right here because it is straight and it doesn't deviate off into other veins, so we know that there's probably not a valve nearby. It's going to be a good one. So while that blood is filling in there, we're going to clean the site for infection prevention, 20 to 30 seconds. And while that is air drying, we're going to uncap the needle and then bevel up, insert at an angle until we see a flash. All right, and once you get that, we're going to advance the catheter while pulling out the needle. All right. Sharps. And I'm going to attach my J-tube, extension, clamp it, and do the tourniquet. Clean up any of this excess blood. And next we're going to attach saline, unclamp, extension. Gonna check for blood return. We have blood return. We're gonna flush it with normal saline. And then simultaneously we're going to clamp it for positive pressure. Clamped. And I'm going to attach that, apply the tegaderm, and tape it down so it stays in place. One last step before we're done. You're also going to want to tape the excess tubing to prevent it from getting snagged or coming undone. Thank you. All right, so now that we've inserted the IV, we are going to be monitoring the patient for potential complications or adverse effects. So one of the more common ones is going to be infiltration, and so things that you're going to look for are going to be swelling in the area around the IV insertion site, and coolness to the touch. It just means that the catheter has been dislodged from the vein, and now the fluid or the medication is getting put into the sub-Q tissue. Another common effect that you're going to be looking for is going to be infection. So you're going to be monitoring the insertion site for redness and swelling, any pus or oozing from the insertion site, and fever is also a common sign of infection in the patient. Other complications are going to be hematomas or air embolisms. You just want to monitor the patient as best you can.